Rihanna once said, "Shine bright like a diamond." But to experience that diamond shininess, you've got to be able to see it. How best to do that? Well, perhaps the answer is blended vision. I welcome Dr. Alan Coe to talk about blended vision today. Dr. Coe, hello.
Thanks, Matt. Hi, good evening, everyone. I'm Dr. Alan from Vista Eye Special in Malaysia. So today, my topic of discussion is about LENTIS Mplus IOL family, the blended vision approach and result. Okay, first, I have no financial interest on the safe products. Okay. So I'd like to start with some simple intro on the Mplus IOL. The LENTIS Mplus is an IOL with continuous transmission technology. It's the first IOL with very focal optic segment and high balance effect. The lower sector shape part will focus the light from the near, and the rest of the lens will focus the light from intermediate and far. Yeah, according to the study by Prof. Alpha in year 2011, the advantage of this LENTIS Mplus IOL design is that it has only minimum loss of light energy. It's approximate about 7%. And compared to others refractive and diffractive multifocal IOL, which have much higher loss of light, which result in loss of contrast and more scattered light and halos. Okay, look at the defocus curve of the LENTIS Mplus. It's confirmed that the visual acuity outcome from the distant, intermediate, and near vision visual acuity test actually provide vision with a very broad range of vision. Okay, in my country, Malaysia, and also most of the Asian country, there are two options of LENTIS Mplus IOL. The LENTIS Mplus MF20 and the LENTIS Mplus X MF30. The Mplus MF20 is with the 2+2 diopter additions. Is the lifestyle multifocal, which without much side effect, and that focus for near and focus for far and intermediate range. And while for the MF30X with the +3 edition is offering good distance and intermediate vision and also excellent visual acuity for the near range. It's optimized for the intense reading. This is especially good for Chinese character, which has more stroke of line. So what is my experience with this LENTIS Mplus IOL family? I started using this LENTIS Mplus MF30 since October 2012. Present, I have implanted more than 5,000 of LENTIS Mplus, and I started to use Comfort MF15 since 2013 and more than 3,000 implanted. And I started using the Mplus MF20 only in year 2015, and I usually use in blended vision with the LENTIS Mplus X MF30X. More than 2,000 were implanted. What is the advantage of the Mplus 30? There's a minimal loss of light, patient having a high contrast sensitivity, and high visual acuity in the far, intermediate, and near. And most of the patients are spectacle independent. Some limitation on the MF30 is that they do have some little dysphotosia, and patient need more time to adapt to the lens. While compared to the MF20, these lens have high visual acuity in the far and the intermediate, and also have good low light vision and minimum to non-dysphotosia. But the limitation is that you have a limited visual acuity at near, about some patients still need the spectacles for readings.
Oh, I just mean it. It seems that there's many different types of IOLs here. That it's all within a family of lenses. So it seems like you can really customize your approach to each patient. Is that right?
Yeah. Usually I will see what the patient need and what are occupation and what their lifestyle. So my current approach currently, if the patient need a bilateral surgery, I will doing the non-dominant eye first with the LENTIS Mplus X 30 MF30. And if the patient is very happy with the near vision, I'll put in the LENTIS Mplus MF20 for the second eye. But if the patient want more near vision, then I'll put in the LENTIS Mplus X for both eyes. So what is the result with the LENTIS Mplus MF20 and the MF30S blended vision? I have had do a simple retrospective study of 100 patients, done bilateral implantation with LENTIS Mplus MF20 and LENTIS Mplus S MF30. So I look at the uncorrected bilateral visual outcome, the distant, intermediate, and near at 1 week and 1 month post-surgery, and given some questionnaire about 3 months follow-up. And okay, the demographic data, the age of the patient is mainly 41 to 74, mean about 53, and type of cataract is mainly clear lens or mild cataracts. And all the surgery were done with femtosecond laser, use the Zimmer Z8. Okay, and this is all Asian eye. And this study comprised of 100 patients who have successful bilateral femtosecond assisted cataract or clear lens surgery with implantation of LENTIS Mplus MF30 in the non-dominant eye and the LENTIS Mplus MF20 in the dominant eye. I exclude out all the eye disease like cornea or retinal problem. The surgery was done on each eye have been done on the consecutive day, and the parameter analyzed include the binocular uncorrected visual acuity for distant, intermediate, and near, spectacle independent, the optic phenomenon, and the patient satisfaction. Okay, look at the binocular uncorrected distant visual acuity. You can see about 72% patients have 6.6 or better, and 100% of patients have 9.6 or better. This is uncorrected distant visual acuity. And for the intermediate, the binocular uncorrected intermediate visual acuity can have 96% of patients have 20/20 or better, or 100% of patients have 20 or 25 or better. While looking at the near uncorrected near visual acuity, 100% of patients have N5, which is about Z3, or 92% have Z2 vision acuity for the near. When asking about some questions, how satisfied the patient, then 92% of patients are very satisfied with the result, and 96% of patients are spectacle independent, and 80% of patients do not or rarely have any glare or halo at night, and 99% of patients actually will recommended their friends or family to do the same procedure. In conclusion, my study showed that the bilateral implantation of LENTIS MF30 and the MF20 provide very good uncorrected visual acuity for distant, intermediate, and near. And this blended vision approach achieve very high patient satisfaction, and most patients have been practically spectacle independent with close to minimum visual disturbance reported. So most of the patients have a good range of vision, distant, intermediate, and near vision. And most of the patients get back quickly to daily activity, include reading and night driving. And most of the patients hardly intolerable to any dysphotosia. This approach is very good in high demanding patients like refractive lens exchange. Definitely happy patients have gained more referral. Okay, thanks. This is my simple presentation.
Well, Dr. Ko, excellent presentation. You know, one of my other favorite songs is Diamonds and Rust by Joan Baez. And I have to say, seeing your presentation makes other conventional IOLs look a bit rusty in their approach.